Hello, my name is Dr. Mona Morstein. I'm a naturopathic physician at the Arizona Integrative Medical Solutions Clinic in Tempe, Arizona. I want to talk right now about psoriasis, right? Psoriasis is a very common condition called atopic dermatitis. There are 5 ways psoriasis can come out on a person. The most common kind is called the plaque kind, which are these round circular lesions which have these yellowish scales in them. And they do tend to come out on the elbows and knees, but they can spread everywhere throughout the body. There's also a form called guttate, which are little red lesions that are individual that can also come out and be called psoriasis. There's inverse, which is a red rash. You'd think it almost would look like sometimes a fungal rash, but that's found here in the armpits and the groins, under the breast. There's also a pustular kind, which is non-infectious pus, but can give a discharge in the little lesions on the body. And the last one is this erythrodermic form, which is a really more pro-inflammatory type. The most common kind, though, is that plaque form, and that's what I tend to see the most in my clinic. Now, psoriasis is interesting. It's a skin condition, but it's really driven by the immune system. It's actually classified as an autoimmune disease that the body seems to speed up its own cell division, and as a result, develop these psoriasis lesions. There's one thing that can happen if you have psoriasis, aside from the itchiness of it, the cosmetic aspect of it, is that it can also lead to psoriatic arthritis. In fact, 80% of people who have psoriatic arthritis first had the skin condition develop, and then it went into their joints as well. So how does standard care treat psoriasis? Well, it treats it by topical corticosteroids. While that can make the rash actually go away, it's not dealing with the etiological factor for why it first came out. It's suppressing it. And the more you tend to do that, when it comes back, it tends to come back in worse and worse ways. They also have oral medications like methotrexate and cyclosporin, pretty strong oral medications. But now the leading ways that we deal with moderate to severe psoriasis in standard care is by giving injection drugs, what we call biologics, that decrease parts of the immune system that's producing these pro-inflammatory chemicals that are aggravating and promoting the psoriasis. So drugs like Enbrel, or drugs like Remicade, Humira, Simponi, these are all really strong, nasty drugs. People can get, you're at risk that if you get an infection, it can become a real crisis. And really, they're just kind of unsafe drugs, but they can get rid of the problems of psoriasis and control the psoriatic arthritis. So what do when people walk into my clinic? Well, since it's an autoimmune disease, what we're looking at first naturopathically is a food allergy test, and sometimes we're also doing a stool analysis to see what's going on in the gut. Because the gut, if there's bad bugs in the intestines, that can actually be promoting autoimmunity in the systemic body, like psoriasis. So we might be doing those. We'll be doing a diet diary. We'll certainly be tidying up a diet. When we're tidying up diets that people need to eat, we're pulling out the food or foods they're reactive to, cleaning up their gut if we had to go there. We're also making sure their diet is very anti-inflammatory, because this is a pro-inflammatory condition. We're giving antioxidants to help with contain skin damage and help heal up the tissue, and other nutrients that are very healing to the body. When we do these things, it's amazing how quickly we can find the etiological factors, remove them, stimulate the healing, and naturally eradicate the psoriasis that people have had sometimes for years. So if you have psoriasis, we treat eczemas the same way. Why don't you think about using alternative medicine? I'm Dr. Mona Morstein. I'm at the Arizona Integrative Medical Solutions, and I hope one day I'll be able to treat you.